update.
Joining us now, Republican Congressman from the state of California and member of the House Budget Committee, Jay Obernolte. Congressman, thanks for coming on. Good to see you.
Great to see you.
Talk about it. You're on the House Budget Committee. Top line thoughts on what has just been passed here. I know a lot of cuts are coming over the next couple of years. Talk about it.
Right. Well, for the last 4 years, federal government has been relentlessly increasing federal spending. The actions that we took last night are the first step in actually decreasing federal spending. We're going to get at some of this waste, some of the huge bureaucracy. We're going to find ways of cutting dollars out so that we avoid passing this huge legacy of national debt onto our children and grandchildren. And we're convinced we can do that without affecting the benefits that Americans rely on. And you heard the president make that commitment today.
Congressman, how crucial was this win for House Speaker Mike Johnson?
Well, it was absolutely crucial. I think absent this win, we would have been relying on the actions of just one of the chambers, the Senate. Now we can move forward, sit down, have a conference with the Senate, and agree to something moving forward. But I think it's a testament to the hard work of the Speaker and all of his staff to get nearly every Republican moving in the same direction on this.
Congressman, talk about this narrative being pushed by Democrats that major cuts are coming to Medicaid. President Trump has said on numerous occasions that is not going to happen whatsoever, yet they continue on with it. What do you think?
Well, it's disingenuous to say that specific cuts are being done to any program. All that we passed last night is what we call a reconciliation instruction, one number that gets passed to the Energy and Commerce Committee, on which I also sit. And then it'll be up to our leadership on Energy and Commerce and the entire committee to decide exactly how to implement that. But we oversee many different programs. And as I said, we're convinced that there is plenty of bureaucracy to cut. There's plenty of waste to cut. There's plenty of improper payments to cut before you have to talk about cutting payments to individual Americans. And one last point to make: if you want to talk about being afraid of cuts to Medicaid, those decisions are made by the states. The states is who administers the Medicaid program. The federal government is kind of behind the scenes with funding. So ultimately, the states will have to decide. But the states are part of the problem on this. There's plenty of abuse by the states. We're going to put a stop to that.
Congressman, what are some of the cuts that you anticipate being made by some of those different departments, some that are almost so egregious and so obvious that you just know they've got to go?
Well, we're going to look at the things that are making medical care so expensive in the United States. We really don't have functional healthcare markets. We don't have market forces that influence prices, and that's why prices are so high, because the incentive structure that's in place does not encourage anyone to pursue efficiency. And we think we need to look at efficiency. We need to ask ourselves the question, why do we spend 3 times more per capita in the United States for healthcare than other countries in the world that have superior healthcare outcomes? That's a very important question. And the structure of these programs is part of the problem. So we're going to look at that, look at where the cases of abuse are, where the system is being abused, where taxpayer money is being wasted, and deal with that. And just to put people's mind at ease, this is going to be a hugely historic moment for starting to spend less instead of more. But the cuts that we're talking about making are fairly modest. I mean, we're talking about $1.5 trillion over 10 years. That's $150 billion a year. In a year where we're spending $7 trillion as a federal government. I mean, folks, this is less than 3%. So it's a good start, but nothing that should be having people panicked over.
Thank you for putting it in context. Those are some big numbers when you talk about them. Congressman Obernolte, thank you so much, and good luck on all the work you have to do. I know there's a lot.
Thank you.
And joining